An abnormal smear does not mean you have cancer. Before you panic about an abnormal cervical smear result, I want you to hear me out. Most women think abnormal cervical smear means bad news. It doesn't, and here's why. My name is Mr. Saurabh Phadnis. I'm a consultant gynecologist working in London. I see women with variety of problems such as postmenopausal bleeding, abnormal smears, gynecological cancers. In this video, we'll be looking at what abnormal cervical smear means, what the results mean, and what do you expect from your clinician. You might have been told that your smear is HPV positive, and that might have caused panic and filled up your brain with lots of questions, but it is not bad news. It looks for papillomavirus. The abnormal cells are actually precancerous cells, not cancer cells. The reason why precancerous cells are important because it gives us time to treat them before cancer may even develop. HPV, you need to understand the cervix. The cervix is that area of the uterus which is visible via the vagina. The delicate cells are turned into tough cells. HPV does not mean that you have done something wrong. If I tested every adult today, most of them would have exposure to HPV. In most women, HPV will be cleared by body's immunity. In some women, HPV persists in the vagina over a long period of time and therefore causes precancerous changes in the area where delicate cells are turned into tough cells. This takes a number of years to develop. CIN3 is not cancer, but here is why we treat it. Before you Google CIN grades, please listen to this. One of the key points of cervical smear test is it detects abnormal cells. These abnormal cells are precancerous cells. When precancer is detected on cervical smear test, it is graded in the following manner. It is graded as borderline, and these borderline changes are the mild variety of precancer. There is also mild dyskaryosis, which is included in the minor precancerous changes. Both borderline and mild changes regress spontaneously once your body clears human papillomavirus in about 95% of women. This will return back to normal given 2 to 3 years time. Moderate dyskaryosis is a moderate precancerous change that is detected on cervix smear test in about 50% of women. When HPV regresses or disappears, then these changes go back to normal. CIN3 or severe dyskaryosis is a severe precancerous change which does not regress, and usually treatment is offered to prevent cancer in future. One has to understand that even with CIN3 or severe precancerous changes, there is about 2 to 3 years time before cancer may develop. So we have got plenty of opportunity and time to treat these changes. The progression of precancer to cancer takes a number of years. If you are having regular follow-ups or regular cervical smear tests, regular intervals in the NHS screening program, cervical smear tests are done every 3 years. We will be moving towards every 5 years soon due to the adaptation of primary HPV screening program. Screening only works if you're having regular cervical smear tests. The risk is missing out on these appointments and not having cervical smear tests, not the result itself. Colposcopy sounds scary, but it is not. Let me explain what it actually means. Most fear comes from the word colposcopy, but not from the procedure itself. Colposcopy is a procedure where we have a closer look at the cervix using a magnifying lens. For you, it is similar to having a cervical smear test, just takes a little bit longer. In addition, we use some special stains enable us to visualize the precancerous changes on the cervix. Precancerous changes are not visible to the naked eye. Therefore, the clinician who is doing the colposcopy should be able to explain to you immediately whether there is an abnormal area on the cervix and what does that mean. Does it mean similar to your smear test, or is it worse? Sometimes a biopsy is needed to confirm the grade. You may be offered local anesthesia for the biopsy. Most of the times may not be necessary. When treatment is offered, it is usually done under local anesthetic. 80% of women tolerate it in the outpatient setting. HPV positive smear is not a life sentence. When you have a HPV positive smear, life continues normal. There are no particular precautions you need to take, and you do not necessarily need to inform your partner. It is not like other sexually transmitted infections like chlamydia. I often say to my patients that if you're HPV positive, almost certainly your partner is HPV positive. And just like your body's immunity will clear HPV or her body's immunity clear HPV, you cannot prevent HPV by using condoms because the transmission is through skin to skin. Once you clear HPV, your screening continues normal. Please do have regular cervical smear tests. HPV infection itself has no implication on fertility or pregnancy. Even when you have a cervical smear test that is showing high risk PV, you should not delay your plans starting family. There are particular supplements are helpful in boosting body's immunity. These are vitamin E or shiitake mushroom extract or even green tea. There are products in market such as Papillocare which have been designed to treat HPV infection. These are an adjunct to help your body's immunity clear HPV and thereby preventing cancer.